Using an ice pack will give you frostbite and make your finger fall off. And using heat on an open wound will make your blood heat up that much that your teeth will fall out. This is the kind of crazy thing you might read if you Google when to use heat and ice for injuries. Heat and ice can be amazing for injuries and they help so much. But there's a lot of conflicting information out there. Do you need to use ice for this injury or apply heat to it? This is a really common question and it can be very confusing to get the right answer. So on this video, I'm going to tell you the best way to understand what to use and when to use it. But first, you have to understand what heat does and what ice does. Once you understand a little of the hemodynamics, you can make a decision about which is best for you. My name is Jeffries. I'm a registered nurse here in Los Angeles, California, with experience in ER nursing and education. So let's start with heat. Heat causes vasodilation, which means it opens up the blood vessels and capillaries. When I try and remember what heat does, I think heat's really comforting and it makes you just open up and just relax, as opposed to ice, which is the opposite. Ice is a vasoconstrictor, and this makes the blood vessels and capillaries close up. So if you think of ice, think it's cold, it's uncomfortable, it makes you shrink and close up. So going back to heat. Heat is the vasodilator. Yes, you got it. Heat makes the capillaries, which are your smaller veins, and the larger veins open up. So if you think of a hose pipe, it's constricted, it's closed, not getting much blood circulation or fluid through it. Then if you open the hose pipe up, if you let go of the hose pipe, the fluid gushes through. So this is what heat does. That's how I remember what heat does. It opens up the capillaries and blood vessels and gets the blood flowing to that area that the heat was applied to. So this works really well for those sore, stiff, dull, achy joints. Those areas that you wake up on a morning and they're just stiff and aching. Applying that heat gets the blood to rush there, and more blood to that area means more healing is happening. Before we go over ice, I want to know, what have you used heat or ice for? What packs did you use? I'd love to hear in the comments down below. And also, I have to mention this video is for educational purposes and not a replacement for medical advice. Now, ice, on the other hand, remember we said ice is a vasoconstrictor. This closes up the capillaries and restricts the blood flow. So again, visualize a hose pipe as your blood vessel and you apply the ice. This shrinks, so there's less flow of the water. Same thing happens with your blood vessels. Applying the ice reduces the flow of blood and fluid and it shuts down the swelling. It shuts down the inflammation and pain early on in the injury phase. If you think when you first get an injury, it's painful, it's swollen, it's fat, and ice is great for that acute new pain in the first few days. Anything older and you might want to consider heat. In terms of the amount of time for applying heat and ice packs, a general rule of thumb is no more than 20 minutes on and then 20 minutes off, at least 3 times a day. Or you can check out my video for specific methods for ice and hands. You have to find what works for you, but limit ice and heat pack exposure if you have diabetes or any condition that limits your sensitivity to feeling, as this may cause damage to the nerves and tissues. Another good rule of thumb is to look at the area that you're using heat or ice on and remove the pack immediately if you see the skin in that area get dark, red or purple. This is a sign that you're getting some skin damage, so take the ice or heat pack off and check it out. Click here if you want to know the best way to ice your injured hands. I've done a full video what goes over the best way to ice your hands.